Good afternoon, everyone. My name is Candice Hicks. I'm with Fairfax County Consumer Affairs. I'm a Consumer Specialist 1. Prior to my employment here, I was a parole and probation officer for the state of Maryland for approximately close to 10 years. And today I'm going to do a presentation for you all on medical billing. So how many have visited their primary care doctor lately? Okay. Been to ER? Urgent care? So that's all of us. So with our bodies, we have to go to physicians for maintenance, just like you go for maintenance for your car. You have to keep maintenance on your body because your body can get ran down as well. So this is an important presentation for all of us to note. Today's medical billing overview includes Consumer Financial Protection Bureau, CFPB, interesting facts about medical billing and collections among older Americans, common medical bill problems, inaccurate medical bills, the impact on consumers, and tips for reviewing medical bills for accuracy. Because after all, why pay a bill that you don't owe? In these days and ages, we want to keep more money in our pocket than to spend out more money. So medical billing collections among older Americans specifically. Adults 65 and older reported $53.8 billion in unpaid medical bills. Nearly 70% of these older adults with unpaid medical bills reported having medical insurance coverage from 2 or more sources such as Medicare, Medigap, TRICARE, or their employer-based coverage. Older adults face a complex billing system with a high likelihood of errors and inaccurate billing. Complaints submitted to the CFPB involving Medicare cite inaccurate billing as a source of unpaid medical bills and collections. Consumers who reported having multiple sources of insurance were especially likely to note problems with inaccurate billing. Millions of older adults, 65 and older, are covered by Medicare and Medicaid. These individuals are known as dually eligible beneficiaries. Most dually eligible beneficiaries should have little or no out-of-pocket costs for Medicare-covered care. There are federal, state, and law that prohibit providers from billing certain duly eligible beneficiaries from payment beyond a nominal copay set by the state, if any. Despite these protections of the law, older adults with Medicare and Medicaid are still more likely to report unpaid medical bills than the general older population. CFPB findings suggest that providers are billing older adults with dual beneficiary for amounts that they do not owe. Providers and billers refer inaccurate medical bills to collections, and it often affects the credit reporting, which results in significant consequences for older adults, health and financial security. In CFPB credit reporting complaints, for example, older adults describe how inaccurate medical trade lines on their credit reports have affected their access to affordable credit. Older adults also report that trying to address inaccurate bills that are in collections and appearing on their credit reports takes a significant mental and emotional as well as physical toll. Older adults' unpaid medical bills by insurance coverage. These statistics, the most recent statistics, are from December of 2020. The total amount of unpaid medical bills reported by older adults increased by 20% between 2019 and 2020, from $44.8 billion to $53.8 billion. The average and the median amounts in unpaid medical bills reported by older adults were also higher in 2020, $13,800 on average and $1,500 the median. And in 2019, $11,700 on average and $1,200 for the median. These increases are higher than the growth in Medicare premiums and greater than overall Medicare and health spending observed between 2019 and 2020. They are also surprising given that older adults who reported unpaid medical bills in the survey also reported fewer medical visits to their primary care and lower out-of-pocket expenses in 2020 than in 2019. The persistence of unpaid medical bills, even among older adults with more comprehensive insurance coverage, is at least in part the result of inaccurate billing. Inaccurate billing, as noted in prior CFPB work, are referred, as I mentioned earlier, to debt collectors and reported to credit bureaus, with many consequences affecting the older adult population for housing and possible employment and their credit. Prior CFPB work and other studies have also documented the high complexity of the medical billing system and the effort required from consumers to navigate the medical billing system and correct any errors they may find. Lastly, the amount of unpaid medical bills increased among older adults despite notable recent improvements in the health of older adults with Medicare and the reduction of Medicare coverage gaps for older adults and enhanced assistance programs for low-income beneficiaries for the last 20 years. Now let's talk about some contributing factors toward medical bills and medical debt. Out-of-network charges, deductibles, and other cost sharing, services that are not covered by Medicare, frequent and complex medical care, limited income, as well as medical billing errors. As I mentioned, several factors contribute to unpaid medical bills. Older adults are more likely than younger adults to have multiple chronic health conditions that require complex care. Providers use high-intensity medical billing codes to seek reimbursement for higher level of care. These billing codes provide for larger payments, but they also require detailed documentation. Medical claims using these codes are facing greater scrutiny from insurance companies due to concerns about upcoding and overuse, as these factors are commonly associated with billing errors and claim denials. They are also more likely to live with older adults are also more likely to live with multiple chronic health conditions that require frequent medical visits and complex care. Older adults are also more likely than adults ages 18 to 64 to experience functional limitations that reduce their ability to detect and correct inaccurate bills. As a result, they may be more likely to experience errors and inaccurate medical bills, and the challenges associated with credit reporting and collections on such inaccurate debts may affect them disproportionately. Older adults also are more likely to rely on multiple insurance plans to cover their medical services compared to adults ages 18 to 64. In 2020, 68% of older adults with unpaid medical bills were covered by two or more sources of insurance, compared to 11% of adults ages 18 to 64 with unpaid medical bills. Studies have found that multiple insurers increases the complexity of the billing process. Before you are billed, it is always best to visit a medical provider who is in-network than out-of-network. In-network healthcare providers have contracted with your insurance company to accept certain negotiated discounted rates. You will typically pay less with an in-network provider. Out-of-network providers have not agreed to the discounted rates. So for example, my chief branch manager, sitting right here in the front, told us of a procedure that she recently had, and she assumed that it was covered in-network through her insurance provider. Once she received the bill, she found out that not all the parts of her procedure were covered by her in-network provider. Some was out-of-network. So she was able to dispute the bill to get it down to a significant amount where it was affordable. So it's important, no matter what procedure you get done, that you check to see if every part of that procedure, every physician that may be in that room, is covered by in-network. Also, before you are billed, Make sure you write all your appointments down. For example, if you visited a cardiologist, just to discuss follow-up test results, and then you receive a bill for testing that you did not have done, that's a red flag right there that you should not be charged. So you should contact the billing department as well as your insurance company immediately to advise them that no testing was done at this visit, it was just a follow-up. In addition, before you are billed, before going into a hospital, find out what your out-of-pocket expenses is going to be. Find out what's covered in network, what's out of network. Ask what room and board charges are going to be covered. In addition, bring your slippers, socks, tissues from home. Why pay the hospital's socks, slippers, when you can bring your own to save some money? Also, make sure you obtain the correct pre-approval to bring your own prescriptions to the hospital. So don't just assume you can just bring your own prescriptions, because you don't, after all, want it to affect with whatever procedure you're having done. Once the bill arrives, this is important, review your statements and bills promptly. Don't be negligent and just let them sit there and say, I'll take care of them later. Typically, you will receive an explanation of benefits, EOB, from your insurance company, and then separate bills from each of your medical providers. If the hospital has sent you a summary bill, contact its billing department and ask for an itemized bill. You should receive that within 30 days of your request. In addition to reviewing the explanation of benefits, learn about the total cost for a visit or a procedure prior to having it done. The insurance company will be able to provide you with that information. Also, double-check your medical bills with the EOB to make sure you're not paying more than the amount that is listed. And let's discuss some common medical bill problems. You want to verify your name and insurance information. A simple typo that changes the group insurance number can result in higher billings to you. Make sure hospital billings include your correct patient room number. So if you didn't have a private room and you had a semi-private room and you see that you charged for a private room, you want to contact the billing department immediately to have that corrected. Confirm also that you've been billed for the correct procedure. Errors can easily arise if the billing department enters the wrong billing code or makes some other clerical mistakes. Make sure you're not charged for tests or procedures that were never performed. Look for duplicate charges on items like medication, lab work, or other fees. There shouldn't be 2 entries for a single medical test. Also, bundled billings increase the risk that you may be charged twice for the same item. For example, assume a hospital room and board fees cover the cost of a nurse handling the patient and the medication. If the hospital also charges an oral medication fee, then it's billing you twice for the same service. If you have questions about what's included in the bundle fee or bill, contact your provider or the medical facility. In addition, common medical problems. Facilities typically bill for OR time by the minute, which can make errors in billing very time-consuming and very expensive. Because your anesthesia records state the time your surgery began and ended, they can be used to determine if the correct OR time was documented. Confirm that you have not been separately billed for items often included in OR fees, such as gloves or linens. If you've been hospitalized, check your bill to make sure you've been billed for the right type of room, as I mentioned earlier, and for the right amount of days. For example, you shouldn't be charged a private room rate, as I stated, if you stayed in a semi-private room, and you shouldn't be charged for 10 days if your stay was only 5 days. Of course, if you find a problem, call the provider, explain the billing problem, and ask for it to be corrected. When you receive the corrected bill, check to confirm that the problem has in fact been resolved as agreed. Always make sure you get the name of the staff that you discussed the issue with. If you're still having issues, you want to contact your insurance company if your medical provider does not agree to correct the billing. Explain that you've attempted to resolve the problem with the medical provider but have been unable to do so. If the problem is not resolved prior to the bill due date, pay that portion of the bill that is not in dispute. During a billing dispute, some providers may report the unpaid portion of a bill as a delinquent account. Check your credit reports. If the disputed portion has been reported as delinquent, write a concise explanatory statement of dispute and request that the consumer reporting companies add it to your credit report. More information about credit reports and credit reporting agencies is available at the U.S. Federal Trade Commission at www.ftc.gov. And also, you can file a complaint with our office. We receive about 2% of medical billing complaints. So if the medical visit occurred in Fairfax County, you can file a complaint with our office. If you have any bills or invoices, provide that information to us, and we will do our best to mediate it with the medical provider. In addition, if there's no resolution that is able to be reached between our agency and the medical provider, there is a rebuttal process that is available. And here's a search complaint history of our website, where you can see how we've handled other medical billing situations in the past. Of course, if you have any questions or concerns, or just want to chat about a possible medical billing issue, you can contact our office at 703-222-8435. Our advice line is open Monday through Friday, 8 a.m. to 4:30 p.m. Thank you for your time, and remember to check those medical bills before spending money you don't need to.